he has had some. I mean, he's drove a truck and he's operated a little bit of heavy equipment, so be putting him on a blade for the biggest part. So
That kind of puts you up to about full staff, or?
probably one more, but I'll probably wait till all this blows over.
Okay,
I've actually had that'll kind of get all the blades with operators. The one blade operator is part-time. It's Charity, but I've had her on the blade since the first of the year. So.
I've heard she does a good job.
Yeah, she's been doing a good job.
Where's this new guy gonna work? What's this?
He'll be on the west side of 183 down to T, I believe it is, and then he'll have straight north of town and a mile west of 183, and he'll have G Street. So
He'll have the west end of G from 183 west.
yeah.
who does the county line northland from the 183 over to the northern road?
That'll be part of his also. So we just kind of.
I went on it the other day and it was good shape. I thought
Actually, Charity she bladed that the last time. So
it was good shape. Well, I'd move we accept the payroll changes.
I'll second.
Been moved and seconded we accept the three payroll changes. Is there any other discussion on this motion? If not, those in favor signify by saying aye.
Aye.
Those opposed, same sign.
we've got two culverts down on the Wilmore Road south of Belvedere. We're going to try and get them replaced this week. One of them's plugged up and the water was actually running across the road, and the other one caved in, I think, and it was just as rough as it can be. So I got them located with the utilities, so we're going to see if we can't get them replaced this week. And there's 3 culverts there in Belvedere on the south side of the blacktop that I got that located, and we're going to either try and get them cleaned out or maybe replace 1 or 2 of them, and so we can't see if we can't get the water draining like it. There was a lot of water running down there. So I guess that's all I've got, unless you all got something.
I was south of Rick Shear the other day over. What's that culvert that's the end of it sticking up so high?
Yeah.
On that
we need to get over there and cut it off.
What, did they hook it with something?
Yeah, can you imagine that? Well, sure
That surprises me.
Yeah, it surprises all of us. Yeah. All right.
Well, thanks for coming in, Jay.
Thank you, Jay.
Is Carrie still coming?
As far as you know, Carrie's gonna be here.
Yes, I reached out to her. She wasn't scheduled till 9:30, but we'll see if she can come in early. If you'd like, I can go ahead and present my tax correction.
Okay, that would be a good deal.
The only thing I have today is a tax correction for personal property. It's just a semi that wasn't on the rendition.
I move we accept the tax correction.
Second.
Been moved and second, we accept the tax corrections. Any other discussion on this motion? If not, those in favor signify by saying aye.
Aye.
Those opposed, same sign.
Somebody asked me the other day if we had ever done contracting on grading roads. And I said, I didn't know. I would ask, has that ever been, is there counties that do that, contract companies to come and do grading?
I've never heard of any.
I didn't know. I hadn't either. I didn't know. But I said I would ask. I don't know. I don't know who you would find that would do that, especially in this rural of an area. They may do it in the metros.
Only thing I can remember, I think we hired somebody to help with the snow removal, didn't we? One time. It was in the March of that one year. I don't know whether there's any county do that or not.
I don't know.
We could talk with.
Well, you could see somebody like Sedgwick or Wyandotte or somebody like that. They got so much area and so many people. Of course, a lot of theirs is blacktop too. No secondary roads. So I don't know.
Yeah, it's a few townships left, but you know what I mean. I never heard of nobody doing it on contract.
I guess I could open up the commissioner discussion if anybody got anything.
Have y'all looked at this insurance? Which one of these plans are we on? Self-funded?
I think it's about as good as we could expect, don't you?
Yeah.
Gonna be kind of flat there, isn't it?
Yep. Hello, Shay.
Hi there.
I guess this is the first time we've had a flat renewal in quite a while, isn't it? Morning, Carrie.
Hi, Gary.
Morning, how are you guys?
Good.
All right. I guess you got here just the right time.
I did. Were you waiting on me?
No, it just wasn't 9:30 yet, but we're ready for you.
Okay. Well, I about blew over here. Goodness. I was just going to give them a quick update, so I think that this can all be done out of Board of Health. If that's all right.
Yep.
Just wanting to give you a quick update and then chat for a second. So far, the state of Kansas, as of yesterday at 10 o'clock, is at 747 cases. You're welcome. Let me borrow yours so I can look at it. 747 cases, 22 deaths statewide. And as you can see, it's both of our neighbors to the east and west have positive cases. So with us being a travel through county that's always concerning, we have been testing people in our county. So far, all those that we have tested have come back negative. So that is very good news for those people. We hope that that continues for a while. But just wanted to let you know that we are testing people. So, wanted to let you know that that is happening now. We continue to get some supplies in. Ray's been working pretty hard at getting some extra supplies in, PPE, masks, and things like that, so we can share with the local entities, in-town hospital, Iroquois Center, Howland Care Center, pharmacy, things like that. So when we get it in, we're able to divide it up and share amongst the different groups, so we can hopefully make sure that we all have masks and gloves that we need to kind of get us through this. So that's what we were working on over the weekend. So, and then I was just going to ask, our office has remained open. We are still seeing patients, as you guys know, providing services. That has not changed for us. In fact, we've kind of seen an increase in some services, like the need for WIC has definitely increased, seeing as some people have lost their income. The need for some of those services has increased. Family planning, immunizations, things like that. Foot care has not stopped. We are screening patients for COVID-19. That's part of the process in Kiowa County. They either come to us or talk to us first, and we screen them before they go to the hospital, just to try to keep the ones who can be tested away from the ones who cannot. And so with that, I was going to ask if you would consider the time and a half pay for my staff as well.
We're an essential part. You gotta stay open.
We do have to stay open. We are staying open, yes.
Yep. We done the jail dispatchers and jailers and everybody's working. We moved them to time and a half
Okay.
for extra pay. They have
Okay.
to work through this. That's what she's wanting to know. The health department have that same,
All right.
but you know, we got the courthouse here doing that too. But they're not seeing the public, I guess.
You have enough in your budget for this, I assume?
We supposed to review this policy the 26th of April, 29th.
As far as like the governor's policy goes till the 19th. What I had asked was till the end of April.
End of April, that's what I was thinking, it was the end of the month, yeah. And we'll redo things after that, yeah. I move we'll let the health department have extra pay too
I would second that.
through April.
For the ease of Christie's office, I would think that keeping the sheriff's office and our office on the same schedule would make things probably a lot easier for her.
Yeah.
If I can jump in and say
Mhm.
that for you.
Absolutely.
Since it's her doing it on her own, whatever would make things easiest for her. So
Yep. Okay.
What do you do on this time and a half if they go over 40 hours?
I'd have to ask you.
I believe it just accrues regularly after 40 hours. They get overtime for those hours over. So they're basically just going to
Basically
get
time and a half.
time and
Should
a
be
half.
just the
Yeah.
same as they're getting
Yeah.
regular?
Yeah.
Okay. But it's been moved and second, we pay the county health staff time and a half for their hours now. And what'd you say, until we'll review it?
Until the end of April.
It'll be reviewed the 26th of April.
It'll actually be reviewed at the end of April. not
End
the
of
26th.
April.
Okay, end of April, all right.
I know we've got a lot of dates going on with the governor's
Yeah, hers is
date,
different
and
from ours is a little longer, yeah.
ours is a little longer.
Yeah.
I believe that we're going to be seeing it a little longer here. It seems with the way it's traveling, and if you watch the wave of the numbers, I believe that that's where we're going to be seeing it a little
You
bit
seen
longer.
any decreases in it anywhere?
Not yet.
Not yet.
Not yet.
But it slowed down from what the daily.
Yes, yeah, that's what we're starting to see. The initial projections are starting to show that the stay-at-home orders are showing a decrease in the curve.
Right.
So that's what we're hoping is if people will continue to follow the stay-at-home guidelines and do what we're asking, that hopefully we can slow that curve some. So
Okay,
what
is
the
there any
goal
more
is.
discussion on this? If not, those agreeing with this, signify by saying aye.
Aye.
Those opposed, same sign.
thank you guys, I appreciate it very much. Is there any other questions regarding the COVID stuff that I can answer for you?
How long does it take to do the testing now?
It depends on where it's sent. If it's sent to the state lab in Topeka, it takes about 2 to 3 days. If it's sent to one of the private labs, those are shipped out of state, and that can take anywhere about 5 to 6 days. So Kansas does not have the ability yet for the rapid testing. Those are being sent to more those states that have the, like California, Colorado, New York, where they're inundated with those cases right now.
Well, you hear all kind of reports, how long it's from 10 days to 2 hours. I just,
I know.
you hear everything on TV.
That's where we're sitting is anywhere between 2 to 6 days has been the max. So depending on where it gets sent.
Do we have any pending right now?
We do have some pending right now. Thankfully, the ones that we've gotten back have all been negative, but we do have some pending. So that's the longest wait when you're talking about your residents and
Oh,
you're waiting
yeah.
on those test results to come back. So
Well, good luck.
thank you.
Yep.
Appreciate it. Glad to see you're back.
Me too.
So, all right. Well, thank you, gentlemen,
Thank
very
you.
much. I appreciate it.
And Rhonda's available whenever you guys are ready.
You guys ready?
Call
For
Rhonda.
Rhonda Fernandez, yes, for the Blue Cross and Blue Shield renewal.
Yeah, we can. I'm ready to do that.
Yeah.
Okay.
I'm ready.
Hi, this is Rhonda.
Good morning, Rhonda. It's Christy. I'm here with the county commissioners during our regular meeting, so you are on the phone, so go ahead.
Good morning.
Good morning.
Hi.
Morning.
We have received the renewal for July 1 for Kiowa County from Blue Cross and all of our other carriers that we use. And just want to go through that with you and let you know where we're at. On page 2, you will see that the health insurance renewal is flat. We will be paying less fixed costs, which the fixed cost is the money that the county pays Blue Cross to administer claims and you know, all of the services that Blue Cross has to offer. So that went down $39,979. The claims funding is increasing that much, so we have a flat renewal. On Blue Cross, our dental went down $2,041. So we have a decrease in dental. The vision is no change for this year. Our group life, we had a 2-year rate guarantee, so there's no change there. And on the voluntary life, there's no change in the age bracket cost, so there's no change. However, if I went up an age bracket, my rate personally could go up, but they are all the same as they have been since the inception of the plan, so there's no change there. And at this point in time, our flexible spending account, we're not seeing any fee changes as far as admin costs there either. So if you'll go on to page 3, I've kind of broken down in the same chart that we've been using every year, what our current, the county paying and the employees paying for this year, and then starting July 2020 at the bottom for next year. You will see that the county is paying all but $80 on a single and all but $200 on the rest of the plans, the employee spouse, employee child, and family. So your employees are contributing $107,520 a year towards your cost to Blue Cross. You will see going down just a little bit more detail of what I stated in the beginning. If you'll go down to fixed costs in the first box, you will see that's what we are paying currently, the $310.72 on single. So if you'll go down to the next box at the bottom where it says fixed cost, you see that cost is going down $285 to $285.92. So clear cost to annualized, I know it's hard since I'm not there to go through this with you all. Currently, your fixed costs are $388,991 with Blue Cross. They will be going down to $349,012, but we're putting that money back in funding that decreased. So there's absolutely no change in numbers for the July 1, 2020 year through June 30th of 2021. So I'm hoping no noise this is positive with you all. Any questions?
Yeah, we was expecting about a $500,000 decrease, Rhonda.
What was that, all, Bert?
Yep.
One of the things that I was talking to Christy about while we were working on this is I think I'm remembering right, and I think Christy confirmed that, you have kind of a flat, you're not supposed to have any increases in costs with the state of Kansas for 3 to 5 years, I believe.
Right.
So this keeps us building that fund. So when we do have a possible rate change next year or the year following, we are staying within that budget parameters, keeping your numbers hopefully flat, because we have those reserves, even though it's not an extra $500,000, Bert, we have those reserves to help offset that rate change when we do have it.
Right.
So I think that's very positive.
Yeah.
So because our claims are a little higher, Chris and I've talked a couple of times recently, And I was just kind of holding my breath that we weren't going to have a rate change, and so I'm very pleased that we didn't. So we're running a little closer to, instead of expected levels, which is where we want to be, we are running closer in that we have a 25% corridor there for maximum. We're running a little bit closer to probably 17, 18% in between. So I really am comfortable with the renewal and pleased to see it didn't change. Actually, the fixed cost, which is great, that money you paid with Cross has decreased. So that's more money staying in our bank account there for claims. So which will help us offset renewals, going forward. So, but again, our claims are running a little higher. I know Blue Cross is doing everything they can to try to keep things as flat as possible with everything going on right now. So I would say you're renewing at the right time because all of that's being taken into consideration right now. So really pleased to see that. Any other thoughts?
I don't have any more.
Not that I know of on
I
that.
don't either.
Okay. The next page is just the breakdown that Christy's office uses for new hires, kind of breaking down the cost a little bit. It tells them what an employee would pay and what the county would pay. So that's just kind of a breakdown, more for your supervisors, I think, and also for down the clerk's office to do payroll and those kinds of things. If you'll flip on to the Delta Dental, there's some positive things here. Obviously, the rates went down. Delta, one of the reasons we chose Delta is you are pooled with the groups across the state of Kansas, and the pool is running really well. In the past, we've had what you'll see is 3 tiers there that say 100%, Delta PPO, Delta Premier, and out-of-network. Obviously, if you go to the PPO or Premier dentist, there's no out-of-pocket back to you over and above what the benefits are. If they write it off. We've had the Premier Network. The PPO network now participates in this same program. So if I choose a PPO network provider, that's saving the pool money, and that's why we're getting a little bit of a decrease this year. So it doesn't matter which provider you go to, you still have the same benefits. It just helps the pool. So just so you're aware of that, that's kind of why there is a decrease, changing those benefits to allow them to commingle. The next page is something I think is very positive, and it is the Right Start for Kids. This program started January of this year, and it is allowing any of those children under the age of 12 to have 0 deductibles in an area there. Maybe there's a $50 deductible, they would not have to pay that. And all of the services listed here are paid at 100%. So under 12, your employees, have any employees under that age, basically they have no out-of-pocket for dental care. So I think that will be, positive, helping families, young families have less out-of-pocket. And so far, I've had a lot of really good comments when I was able to go out and visit my group. So just since January, I've had people even call, is this right? Shouldn't I be paying something? And so it's been well received to have that 100% for children under 12. So that's kind of, I guess, the renewal in a compact space. And so my recommendation would be to renew as is and continue with Blue Cross for the 2021 year. And the current benefits that we have in place, that there's no change or decrease. So, except for the decrease on the dental, which is also nice.
Looks
What
good
do
to
you
me.
guys think?
Yeah. Looks good to me.
I think we need to get the renewal working.
I'm sorry, I didn't hear that question.
Go ahead and get everything rolling. Yeah.
Okay.
Well, we need a motion. I'll move that we continue on to Rhonda and Blue Cross and Blue Shield, our health insurance providers.
Second.
Moved and second, we continue on with our healthcare provider. Any other discussion on this? If not, those in favor of this motion signify by saying aye.
Aye.
Those opposed, same sign.
Thank you, Rhonda.
Thank you all. I wish you a good day and stay healthy. And Christy and I are working on some ideas when we can get a little closer here to doing meetings or getting handouts to your staff. So we will be working on that and getting renewal paperwork to Christy and get things signed and moving forward.
Okay.
Thank you.
Thank you. Appreciate your time today. You all have a good rest of your week.
You too.
Thank you, Rhonda.
Take care. Thanks.
Bye-bye.
Bye.
Do we need to visit about anything on commissioner discussion? Shay, you got anything today?
Not really. We've finally got the last few ones we were waiting on, even one that I wasn't expecting on the neighborhood revitalization plan, one that I thought I'd pretty well written off because I hadn't heard anything. We've received them, so I'll get that mailed out to the Attorney General's office today. Other than that, nothing really from my office. We probably do want to probably at the next meeting, we'll want to talk about whether we want to move or keep the Belvedere Schoolhouse sale date of May 7th. There's no, unlike with the tax sale, there's no we don't have to move it, but we may want to consider it if things are still going to be in lockdown because, well, can't really have an auction with it being in lockdown.
We'll probably know a lot more by then as far as
What I'm hoping.
what's going on.
Yeah.
Yeah, we can cancel it up to the last day, can't we?
Yes.
A week.
We'll just have to do all the notice again.
Yeah, do it at least a week ahead.
We should, give at least some advance notice of it. I think by next week, not next week, by the next meeting, we'll know whether the governor's going to keep her order in place. We'll know where things are going. We'll have a lot better picture of where this is.
Yeah.
And I think we can make a better decision there. I just want you guys to be thinking about it as we get closer.
Well, if nobody has anything else, I'm gonna adjourn the meeting at what time at 9:37.
Johnny, good to see you back.